Hi, thank you for joining us. My name is Laura Joseph. I'm with Healing with Spirit and Healing Trauma Through Spirit. We are here talking to Dr. Tawny Kross, and we're going to be talking about healing sexual trauma in the military. And it's funny because we were chatting before we recording, and there's a lot of overlap when we talk about somatic symptoms. So it'll be very interesting to see how this conversation goes. This program is called Triggers in Spiritual Medicine. And this program was kind of born out of the idea that trauma crosses all platforms. And I think, especially after seeing what was happening unfolding with the pandemic, that whether we're talking about anti-racism or people that are homeless, or if we're talking about addictions or domestic violence or sexual assault or immigration, whatever the challenge might be, there's a common thread that's between all of them. And that is the trauma. That is, how are we dealing with the triggers? And then what's the medicine? And the one medicine that typically goes unacknowledged is the spiritual medicine. And how that overlaps both with traditional medicine, whether it's physical or mental, but it's in order to heal trauma, it's how do we restore wholeness, right? How do we become whole? So that's kind of where this program has been evolved, and where I have felt a calling to how do we bring in different guest speakers and different collaborators and talk about triggers in spiritual medicine that crosses all these platforms, and how do we tie it all together? And how do we restore wholeness in a culture that now has probably, I used to say, an epidemic of unresolved, unhealed, unacknowledged trauma and triggers. I want to say it's more of an endemic now after the pandemic. So I think this has become more of an endemic, and we just go, well, you just deal with your stuff, you know? So thank you, Tawny, for joining me. And just to kind of give everybody a little bit of background of Tawny's background, she has worked with Veterans Affairs Hospital for nearly a decade now. And through the course of her own practice, she has developed a very comprehensive and integrative approach to physical therapy, which evolved from the necessity of such an approach in her work with the complexities of those who have chronic pain. This includes nutrition, hypnosis, guided imagery, mindfulness, among other practices, as well as focusing on the mental health, and being trauma sensitive is of particular importance, as many of her clients have experienced military sexual trauma. And as we chatted beforehand, we were saying 1 in 4 have been sexually assaulted. Most of them go underreported. Sometimes they don't even connect the dots that what they're feeling or experiencing is a trauma response, right? And how many of them are actually men that have been sexually assaulted, which, one of my first guests actually is an expert in working, he calls it men's work. And he does a lot of work with men, because men, there's a shame component, right? Even more so with men, that especially if they're sexually assaulted, it's like, well, there's that stigma there, right? So welcome, Tawny.
Thank you for having me.
Yeah, so let's just start off, kind of give the viewers of like a quick kind of synopsis of how you got to doing this kind of work. And then I want to lead into, I know we were talking about like the chronic pain, and then how did seeing all this lead to the solutions? Like, what's the medicine?
There's a lot of answers and questions in those things of themselves. So yeah, I like to emphasize in the beginning that I am a physical therapist to begin with. And how I got into this work was a very long path. Interestingly enough, when I was in undergrad, I actually wanted to start with a psychology, but my mom decided that was not for me. And so I actually didn't go that route. But I got into physical therapy, and what I saw is that there were almost like a stereotypical presentation for a certain group of people within the chronic pain realm. And their personalities were usually of a certain way. The way that they behaved, how they interacted with people were of a certain type. And it showed up very consistently in the chronic pain population. And those were the ones that could not ever really seemed to make much headway. They made some headway in the short term with traditional physical therapy, movements, stretching, and modalities, but there just was no long-term effect. And I couldn't wrap my head around it. I'm like, okay, this should work. This is a physical pain. Why are these people not getting better? And then if you dive into the history, there's a lot of stuff with PTSD, and some of them definitely have more stuff on the end of like, IED explosions or things of that nature, combat history. But a good portion of them had military sexual trauma. In fact, if you look at my clinic profile of the people that come in to see me, it is like heavily dominant on like 80-90% of them seem to have some PTSD and combination PTSD MST. And when I was looking at this stuff in the beginning, I just realized I had to figure out, do I just let these people continue to go through the cycle of just going through movement again and again? Because you see so many repeat players, and they're at a loss because they're just told, go through the system. Or I had to figure out what was going on. And so I started to look more into chronic pain in general. And as I explored more and more, I realized there's just a huge psychological component that conventional medicine misses. Everybody sticks to their realm, like psychology sticks to psychology, physical therapy sticks to physical therapy. And that's kind of how I ended up where I am. And I do like to emphasize here too, that physical therapists have behavioral health and mental health in their practice, their scope of practice. Obviously, it's not the same thing as talk therapy, but what we can address things within those areas.
I'm glad to hear that, because I've been working with trauma survivors now. I think I'm going on 17 years. And I just work things differently. But one of the things I think now they have terminologies for it now, when like 10 years ago, there was nobody was even addressing the somatic part of trauma. And I know even with myself, I was diagnosed with complex PTSD, and I didn't even develop the complex PTSD necessarily from the abuse, but it was actually going through the system seeking protections from the abuse is actually what triggered the domino boom, 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 boom. Mm-hmm. And one of the things I noticed even with myself was it wasn't so much in the mentals, but there was some, but very little, did I have anxiety? Yes. Did I have insomnia? Yes. But what it really and how it was presenting was weird somatic symptoms of PTSD that I think, and doctors aren't trained in this. Even psychologists aren't even trained in this. And I think this is where we miss when we treat folks with trauma and PTSD, how much of it really sits in the body. We want to compartmentalize, right? And I know just through my work and even healing, I call it healing the broken me, that when you bridge, I said, we have this neck for a reason, right? Like this neck connects the mental body with the physical body, but yet we have been conditioned to make this separate, right? And it's like, well, how do we integrate it? How do we go back into the body? Like I have people sometimes when we do mindset work, I'll say, okay, so you say you hate that person, right? Because they triggered something within you. So what does that look like? Like, how is your anxiety? Oh, it's really bad right now. Okay, so let's just look at that word hate that you just said. Can we choose just a different word? Like I have a program we call the power of the word, the power of the pause, the power of processing. Because we don't realize in this country how much words affect our somatics, especially when trauma is involved. Right? I'm sure, because I noticed you also do mindfulness, right? Mm-hmm. So, how does, like, when you see this, so take me through and walk me through, like, how do you take some, says I've got this chronic pain, nothing's working, or maybe I'm concerned about developing an addiction to opiates because even that's not working, right? And take me through your process of how you get somebody who may be storing their pain into a process of actually feeling empowered and whole again, that they feel like they can actually live free without that trauma and those trauma cords running like an operating system in the back of their mind, in the back of their body, right? Like a computer system.
Mm-hmm. So I think that's a pretty complex question, because I think the end result of being free and feeling empowered often feels a lot further away than that very first session. But the first day people come in, because most people, medical providers, like you mentioned, included, will come in and have purely this idea that it's physical. And they are most often not receptive to the idea that you're proposing that it's something else, because then they're going to hear, you think I'm faking it.
Well, yeah. I mean, my father was an osteopath, and back then the doctors used the terminology of hypochondriac.
Right. Exactly.
Right.
So none of that is something that they want to hear. So you have to work your way gently into building them into a receptive system or receptive person that will hear those things. So what I like about my profession, though, is because I come from such a physical place, that people, when I do an examination with them and I walk them through, okay, these are the signs that this is something that is not tissue based. And I will break down for them what pain is. So my favorite way of doing that is just to be like, have you ever found a scratch or a bruise on your body? And you're like, where did this come from? And they're like, yeah, actually that happens a bunch. And I'm like, so you had tissue injury. Why did you not have pain? And then they look at me again and like, I don't know. So when they're starting to see the holes in some of the ways they believe things before, that starts to open up like a window for me, like, okay, I want you to see these holes. And then I dive down a little deeper and I walk them through the fact that people can have horribly like disfigured bodies and they still have no physical pain. And then so what is pain? I'm like, yes, good question. Now we're going to get to the heart of it. And then we start to explore how the brain is involved. And then we explore, and I do emphasize at some point that all pain is real. I'm like, I don't want you to think that I'm telling you that it's imaginary, because it's certainly not true. And if anybody ever tells you so, you should make sure that like you get the heck away from them. But then we're building that connection and then starting to hear my words and starting to understand what pain is. Then we start to build into the fact that there's some emotional piece that is playing to the pain. And a lot of them have not addressed that. And when you start to open that window of seeing things in this way, even that first 1 or 2 sessions, people often say, I just feel like you've given me a light that I can walk forward in now. I just feel like stuck, like there's no way forward, like this is just what I had. And like, now I feel like there's a sign of hope. I'm like, yes, this is what I want you to see, is just not only having you learn and know what pain is, I want you to be able to see the power that you have in using that information and using like skills to start to help you grow towards healing. And that it is absolutely within possibility, in fact, very possible.
I mean, I think it's like, like I'm going back to like that one person I think I mentioned earlier, where like when they were using the word hate, right? And the minute we changed that word to something more neutral, saying that they were frustrated or they were very intense, which doesn't kind of connotate, really negative or positive. And I said, so now where is your anxiety? And they were like, oh shoot, like it went and I said, now when you can step just enough away. Now the saying that I hate that person was like the guillotine, because that was you putting down a boundary because you just didn't know how, right? You just didn't know how. You didn't know how to respond. So the guillotine kind of came down. It was just easier to say that. But now that you change the language, you can, or just recognizing the body sensations like what you're doing, right? And just giving them hope. Within 60 seconds, it gives them enough hope. And I said, now what I'm saying is like, it's not going to change overnight, but now you can do it. So now the work comes in. So anytime you lack doubt, or you don't think you can do this, or you think it becomes too painful for you, remember you did it once before. And if you did it once before and you overcame that and you were able to get the clarity behind changing language, I mean, I know you're kind of approaching it a little bit different way, but it's like you change that and giving them that hope that you did it once before, even if it was just a quick little crack through the nugget of that pain receptor, right? Or that trauma piece, that trigger piece. To me, that is like gold, because that gives them the thread of the why to keep doing it, and why to keep moving forward, and why to keep plugging through. Because the trauma piece, I always say healing, actual healing trauma fucking sucks. It is not an easy road. It is actually very painful. So you're doing like this amazing work. And tell me, like, how does it come about that, being a physical therapist, that, the survivors feel safe enough? Like, what are you doing to create the safety and the trust for them to be able, especially in the military, where sometimes it's like it's shunned upon, right, to even talk about it. So how do you create that?
Yeah, it's tough, because there are definitely people that come in and they already have that, like, this idea. I don't want to be here. I don't want to be in a hospital. I don't want to be with this doctor. I certainly don't want to be here with COVID. So what I often use humor more than anything else at the very beginning, because it is a way of connecting. And when you connect with someone, even if it's not like a making it safe thing, the connection itself already starts to allow that person to feel safe with you. And when someone laughs, like, they're opening up, they're allowing themselves to be vulnerable, because you can't laugh unless you identify, sympathize, empathize with what you're actually saying. So humor is definitely a huge part. Sometimes it's homework. Sometimes I'm like, okay, you're in the space where you're shut down. Your homework is to go home, find something that makes you laugh. I don't care what it is. Just, I want you to find something that makes you laugh. And then some of it is just mirroring how they're talking to me. I also, I'm more and more, I think, attentive to my own body language, where if they are like sitting directly across from me, I kind of cower down a little bit lower, and I look at them, like, just so that they can see that I'm not trying to come from this top down approach, that I'm either collaborative with them or I am even underneath them. And the language that I use, where a lot of medical providers, I think, come in from the angle like, okay, I'm going to tell you what to do. This is what's going to happen. There's going to be, in my language, a lot more on the coaching end, which is reflecting, summarizing, paraphrasing. And when people hear that they're heard, that also makes them open up too. That's where the safety comes in, because the truth of it is, safety is really hard for, and you probably know this well, for people to access when they have trauma, and feeling safe makes them feel unsafe.
Yeah, it can create, it's like that double-edged sword. I had well, before the pandemic, I had somebody call me once, and they said, and it was for a meditation that I was running, and they said, I have PTSD, and they were a 911 operator, and they said they tried yoga, they tried this, they tried that. But the minute they would basically go into that relaxation response, it would actually trigger a panic attack.
Yep.
Okay. And I had to explain to them on the phone, well, I don't know. Part of it is you have to feel safe and comfortable with the facilitator, which would be me in this case, the environment, as well as the style of meditation, right? Mm-hmm. And so the first time that person came, they sat literally 3 feet from the door. And the minute I started noticing, I was glad that they shared that with me, because I started noticing a shift in their breathing. And it was just enough where I said, oh, I got to shift the meditation. And I shifted. I forget exactly what I did, but I shifted it. And they said, because after the end, we all kind of share our experiences. And they said, well, I don't know what you did, because I was in the midst of beginning this panic attack. And you did something, and it shifted, and it just went. And and you're right. It's like knowing the body cues, listening to how sometimes it's a trigger that we're talking about, triggers, knowing the triggers, being able to know those subtle cues of when a trigger is about to surface, and knowing how to help them with regulation to bring it down. And sometimes it's just that, and listening. You're right. Like listening. I've had clients where they just want to talk. And I'm not a psychotherapist, but they do come in, they want to talk. But when they do that, I'm sitting there thinking, okay, how can I help support them with the skills that I have? And but sometimes when they're doing that, they're also releasing, and sometimes it's just holding that space, not telling them what to do, not telling them how to do it. Like you're right, even with the healthcare, because it's all about, I'm going to tell you what to do. And and I think with COVID, it's really, there's even the trauma in the healthcare field now too, and it's making it very difficult where patients and doctors are doing this right now, and it's very unfortunate. And it's kind of like this, I go, it's like a big mushroom cloud getting ready to explode, because we've got this challenge, and it's how do we work on the regulation, on re-regulating the nervous system, so we can, with whatever tools that we have and we're trained in, so that way we can create safety. And when we can create safety and trust, we facilitate healing. We don't facilitate healing. We help others facilitate healing in themselves, right? Because it's really what we're doing. We're kind of holding that container, holding that space, whether it's through physical therapy, mindset work, energy healing, meditation, whatever that might be. Can you share an example of how what you do and somebody that made a breakthrough and what that looked like?
Oh, let's see what to narrow down with what example. So I would say there's, I'll pull in physical and the meeting of physical and more mindfulness or guided imagery even. So I had a veteran of mine who's like, oh, it's like my pec muscle. It's like my pec muscle. I'm like, okay, it's your pec muscle. But he's gone through a lot of stuff. He's like 2 years or so. And no change. He's tried dry needling, acupuncture, yada, yada, yada. And I was just like, let me just like talk you through what it would feel like to go through more of the mental pieces. And he's like, okay. And I was like, and I'm going to put my hands in the pec area. Because I am doing some light tissue work, but the light tissue work is going to be about as much as if I just rested my hand on your thigh. That's it. And I was like, I'm just going to have you just imagine going through what it would feel like to sense this change in the muscle, like just go through what's happening with the muscle. Imagine like that it's tight and it's unwinding. You can also imagine like the burning sensation you feel being more like a Bengay kind of sensation, where it's kind of like it's soothing, like some of that stuff is hot, but it's also a very soothing sensation. It's cooling. And then as we were talking and I was guiding him through the imagery, he's like, whoa. Because he felt, and I felt underneath my fingers, his pec jump, like it was just like out of the blue. And then he's like, and I feel like this weird cooling sensation in my throat. And I'm like, yeah, and I didn't put any Bengay on you. So, so what you're inviting them is to be able to see the power of the mind in creating that experience. And then there's also some like myofascial tissue stuff you're doing on the end of like releasing, but like even that subtle change, even that subtle resting on the hands can allow you to feel something very physical. And it wasn't like we just imagined his pec jump, and you could probably see it if you ever recorded it. So that would be something like a small breakthrough. There's still a lot of psychosocial stuff that he needs to work through. But I think a bigger breakthrough is,
Sometimes those little ones are needed.
Yeah.
Right? Like we just said it, they need those little ones as a motivator for when they have those bad days, right? Because that's kind of how the trauma. I always tell my clients that it's never what happens when you're in the safe container with me. It's what happens at home at 2-3 o'clock in the morning, right? Yeah. So you need those little breakthroughs as motivators. Well, I did this once. You can do it again. Like,
yeah.
And keep going, right?
Yeah. I think maybe one other example that might be helpful is actually I've been bringing a little bit of voice acting into my practice. And the other day,
you're multi-talented.
No, I don't know why I picked it up. I think it was something I heard about a while back, but anyway, so this woman that I've been working with, she has fibromyalgia, and she has it kind of generally everywhere. And I have been coaching her to actually work on soothing messages for the brain. And it's been helping a lot with calming down her joint pain and her overall body pain. But there was this one area that her hands, especially, that she just could not allow that to make a change. It's like, it's not working for my hands. And I was like, okay, well, like what's going on? She's like, I don't know. It's not working. I don't really know. I just don't know. I think it's going to get better. She has some emotional stuckness about that. So I was like, let's just try something just for fun. And she's like, okay. I was like, why don't you just pretend that I'm a kid and that you are trying to convince me that things are going to be okay. You see that my body's fine, that I just have a boo-boo, and with time, it's going to be okay. She's like, okay, it's going to be okay. And I'm like, no. I really want you to convince me. Convince me. And she's like, it's going to be okay. And I was like, I am convinced. And she's like, she just paused, and without me saying anything, she looked at herself. She's like, I need to do that for my hands. I'm like, yes, because she didn't allow herself to really be part of that soothingness. Like, she didn't believe it. And so she didn't, even when she said it, she still didn't really do it. But there's something about like soothing someone and using your voice, that when you can generate that emotion in somebody else, it's also because you're generating it in yourself. And for that split second, that moment, you have the ability to believe that that's going to be true.
It's so funny because we are a society of turn our power over to our parents, turn our power over. We teach our kids from a very young age, do as I say, not as I do, right? I don't want to see you, I don't want to hear you, like to be seen and not heard, right? And then it's so we're conditioning of turn our power over to our schools, to our teachers, to our doctors, to our systems. And it's all turn our power over to all these things. And I think one of the things that we're learning is like, what I'm kind of hearing is like, we don't know how to turn that power into ourselves because we're so used to just turning it over to everybody else. We don't even know what it looks like to hold that power and to feel empowered, right? And especially as trauma survivors, it's even harder because one, we've either normalized it, right? Like I think I heard you say earlier that you were a guest on somebody else's podcast, right? And how just being on that podcast, and I'd love for you to, because I think these are like little things that can help somebody make a break to go, oh, I didn't realize, or oh, I'm not connecting these dots, right? Where you said like just being on there and just researching about it, you go, oh crap, like, and I'm going to let you go in and explain what that oh crap was.
Yeah, it was. So there was some good pieces and interesting stuff with it for sure. It was in the research when I was like making sure that I understood where our conversation was going to go. And I was like, okay, so what does someone who's a domestic abuse survivor look like? They sometimes it's not physical, sometimes it's emotional. There's a grooming period and all that stuff. And I was like, oh, that's strange. I never really thought of myself as a domestic abuse survivor, but I guess I am. But what was cool about that though is part of the reason I don't think I identified maybe was in the normalizing. But it was also because it's a very old memory for me. It's not something that I think about at all. Maybe once in a blue moon, I have a dream of like being in that same scenario. And I'm like, I thought I took care of this problem in the dream. So for me, part of it is because I have healed from it to the point where it doesn't belong in my space anymore.
Yeah. But I think it's important for folks to also realize, because with you, it may be because you healed, but for others,
yeah,
it could be a normalizing. Because I sometimes see it as one is either as, well, they've normalized it, or they're bypassing doing the work to address it.
Mm-hmm. Absolutely.
So I think that part of your story is just so powerful, because it was like, oh wow, I didn't realize, and I can't tell you how many women and even men don't even realize what that looks like. Or we go into victim blaming and we don't even realize that we're doing it because we have this lens of normalization of what that looks like.
Yeah,
And
actually, sorry, I didn't mean to interrupt
go
there.
ahead.
No, actually, that is a smaller example of the same type of thing
Yeah.
is actually when women pee when they sneeze or cough. Like people, like they assume it's embarrassing, so they don't talk about it, or they assume that everybody, it must be a normal thing, and so there's nothing to address. So in that same way, I think like hiding these symptoms and believing that it's normal doesn't actually take care of the problem when it's maybe common but not normal or not
Right.
something.
So can you share with folks maybe three things, three tips of, and it could be anything from like how to recognize trauma. It could be, things to three tips of how to recognize trauma that's buried in the body and how to move that,
Mhm.
the three kind of takeaways for folks that might be listening in that they can do today,
Mhm.
to help shift that trigger,
Mhm.
that trauma piece. For me, I always say it's stop, pause, and pause just enough so you know what action to take,
Mhm.
right? And to address that challenge. And for you, what would be kind of three things that you think, like think about the clients that come in and the things that you go through with them, and three things that you think could help them today move through or identify sexual trauma or help them move through it.
So I think I probably would come at it in the end of if people have pain, like chronic pain.
Mhm.
So for breaking that down, if one, you have had pain for a really long time and you've tried all the quote physical fixes, that is the first thing, awareness, identification that the fact that this isn't working, then you want to start to explore some of the other stuff.
I
Number,
agree. I mean, to the physical pain, it's funny. I mean, I was fortunate to have a partnership with my father, who was a physician, because anything when he was seeing chronic pain in the office, he was referring his patients when the medical wasn't working. That's when you go, okay, this is probably trauma based, and he would refer them to me,
yeah.
to be seen for me to help them move through what that looked like in through a different lens, and then being able to have the partnership, which I think is also lacking in the healthcare field, for me to be able to go back to their doctor and say, I think X, Y, and Z, when you see this patient, maybe talk to them about X, Y, and Z, right?
Mhm.
Because then that's the collaboration piece, right? Versus the separatization, you
Mhm.
know? And how
Mhm.
do we get all the systems to work together to address one thing?
Yeah. So that was one. And I do want to clarify here too, make sure that any quote red flags have been cleared. When I say red flags, sometimes chronic pain stuff, trauma stuff can be hidden or occluded. It might be still trauma related. However, it can also be like something with like cancer or like, and so all that stuff, hopefully it's cleared by someone who's a professional that can do that for you. And in which case, then yes, you're in the zone where
Yeah.
trauma is going to be part of that body.
Yeah. So I guess it would be basically, I say, like in the book that I have coming out next year, I think I address the chronic pain, and not chronic pain, but chronic illness.
Mhm.
Because I think chronic illness is in there too, is when everything you've done hasn't worked.
Mhm. Yeah.
If nothing is working and you've gone the traditional routes, then you've got to look at the other factors, right?
Mhm. Yep. Number two is start thinking of your pain in a new light. So before you thought about your pain as only physical. And so now if you're starting to think about your pain in a new light, start noticing what that does for you. How does that free you up? Right? Because people were afraid to move because they were harming their tissues before. Now that that's not because you're harming your tissues, but because your system's kind of being on guard or whatever else, start to notice that you can have the ability to move again.
Mm.
And then number three is that the emotional work is hard, but the feelings are just feelings. The sensations are just sensations. They're, you can think about it on the more medical level, which is like their nerves kind of like having sensors coming in and out. There's your heart rate fluctuating, or you can also think about it as energy, whatever you'd like it to be, because some people are not so cool with the woo. They're probably more interested in the medical stuff. But if you think about it like that, the sensations that you feel will pass. They will be replaced by other sensations. It's coming and going, that it will allow you to do the emotional work that can oftentimes be more scary than processing the physical stuff.
Yeah. I mean, are you familiar with Eckhart Tolle's work?
Mm-mm.
Okay. He wrote a book called A New Earth. And he addresses some things, they're kind of very Jungian, but from a spiritual perspective. He has this one story of this woman that came to see him in the book of being unhappy, right? And she just says to him, I'm just tired of being unhappy, right? And I kind of need this fixed, right? And he said to her, if you don't mind being unhappy, like basically, if you just stop trying to fight it, but it doesn't mean succumb to it, it just means that you're just present with it, right? Then what happens to the unhappiness, right? The ego doesn't feed it anymore, right? The head doesn't feed it anymore. And she said, well, I'm still unhappy, but there's space around it. And that was a huge aha moment, because when you have space around it, you get the clarity. When there's space around it, you know how to address it, how to move forward through it. And then the egoic or the trauma piece is no longer keeping you on that rudder of that fight or flight and that hamster wheel spinning out of control. You're able to be like, oh, okay, because when you can see something from a distance, you can shift it and move it, right? I kind of want to go to all those sci-fi movies we see, like all those little things, you see them moving, like all these little, like those invisible kind of screens, right? And I'm like, but we can do that too. We can. We just have to believe that we can, and also know who to go to know how do we shift those frequencies, those vibrations, those sensations, whether it's emotional, whether it's synesthesia, right? The whole physical sensation. So how would somebody be able to reach you if they wanted to learn more about the work that you do?
Yeah, I have a website. It's just drtonykross.com, and Cross with a K. And I also have an Instagram, which is dr.tawny.kross. Yeah, and those are easy ways to reach me. And even on my website, there's like an email and like some contact numbers. So I'm mostly very active on Instagram. So that's probably going to be the easiest
way. Okay.
Mhm.
Any final words you would like to say to somebody who might be struggling with some of the chronic pain issues out there before we kind of close out?
Yeah, I think so more, I think this may be less on the chronic pain end, but more on the just trauma as a whole. We mentioned earlier, Laura and I, about how safety doesn't always feel safe, especially at the beginning, because you've been in this language of protection for so long. And oftentimes when you're relaxed, you can't protect, right? And when you can't protect, you feel unsafe. So knowing that right now safety feels unfamiliar, and just recognizing that, like right now it feels unfamiliar, but as I practice the language of connecting, of safety, and it becomes familiar, and the more it becomes familiar, the more that the brain will allow it to become believable and safe. And that's just something everybody walks through gently over time.
You know, and actually I was going to end right there, but if I could have you add one more thing, if that's okay.
Sure.
Because it brings me to the thing of what we find in our own industries. And that is, what are some things folks can do, especially if they're not able to maybe see you directly?
Mhm.
What are some of the things that they can do to find a qualified, and I don't even know if the word qualified is the right word, physical therapist or somebody that to help them through their stuff? What are some of the things they are to look for and somebody, and I'm talking about whether it's physical therapy, I mean, I do energy healing and mindset work. So it could be anything. It could even be simple meditation, like we just talked about, right? How
Mhm.
not everybody is skilled in even knowing how to address trauma using meditation. Because the
Mhm.
meditation can just help everybody. Well, some meditation can be a trigger if it's not
Mhm.
done the right way, right?
Mhm.
So it's like knowing what would be some of the things you would recommend to folks as far as tips to help them find somebody that, from a safety standpoint, from a credibility standpoint, what would that look like?
Um, I think I would encourage anybody to just identify when they read through their physical therapist's background to see how much of it they're exploring, not just from the physical end. Because if you have a PT that has started to look at things like pain neuroscience education is pretty huge, or psychologically informed, trauma informed PT, or if they are doing sort of more like holistic stuff, nutrition included, mindfulness based stuff, that already tells you that you have a therapist that's looking at you as a whole person and not looking at you just as body parts, hopefully not just a flashback.
That's wonderful. Well, thank you so much, Tawny, for sharing your amazing wisdom and doing the amazing work you're doing with military vets and sexual trauma. And thank you all for tuning in. And thank you. And I look forward to the next episode, I guess. Have a good one, everybody.
Bye. Thank you.